medicines can be beneficial, but there are risks involved, particularly for our kidneys. Our kidneys naturally lose some of their efficiency as we age, so it's critical to keep them from being overloaded with toxins and prescription medications. As we age, we frequently develop new health issues and need more medicines, some of which are harmful to our kidneys. Nephrotoxicity is the term for this condition, which can impair the kidney's capacity to filter blood and result in life-threatening issues. Medication-induced kidney damage can range in severity from minor to severe, with the risk rising with age or pre-existing kidney conditions. The two primary categories of drug-induced renal impairment are idiosyncratic and dose-dependent. Because of dose-dependent toxicity, the harm caused by a medicine increases with its dosage. Idiosyncratic toxicity differs from person to person and is unpredictable. Sometimes it's safer to stay away from these medications. Drug-induced nephrotoxicity can be caused by a variety of conditions, including renal tubular acidosis, renal tissue death, renal infarction, muscle breakdown, rhabdomyolysis, and other problems. Nephrotic syndrome, decreased kidney function, and electrolyte abnormalities can result from these issues. In this video, we'll discuss how common medications can impact kidney health and offer advice on how to take these medications safely. Making wiser decisions about your health might be aided by being aware of these dangers. Watch this video to find out how to manage various medical concerns while safeguarding your kidneys. Let's examine the drugs that may be harmful to your kidneys. First, though, I kindly ask you to like the video and subscribe to this channel. It is very important for us. Thank you very much. Number 7. Antibiotics that can harm your kidneys. Antibiotics can harm your kidneys even though they are frequently recommended to treat infections. It's crucial to understand that taking antibiotics for bacterial infections, such as sore throats or skin infections, increases the risk of kidney damage. Let's first clarify what antibiotics are. These drugs, which are also known as antibacterials or antimicrobials, work to treat bacterial illnesses by eliminating germs or preventing their growth. Brand names such as Cipro, Augmentin, Flagyl, Bactrim, and amoxicillin are examples of common antibiotics. They are used to treat skin infections, urinary tract infections, UTIs, pneumonia, and strep throat, among other bacterial infections. However, viral diseases such as colds, flu, bronchitis, most coughs, and sore throats are resistant to antibiotics. Consequently, when your doctor recommends antibiotics, you should exercise caution. When antibiotics are used improperly, side symptoms such as diarrhea and problems with the liver and kidneys might occur. Certain antibiotics, like vancomycin, aminoglycosides, and polymyxin, can still damage your kidneys even when taken as prescribed. The elimination of antibiotics and other medications from your body is mostly dependent on your kidneys. On the other hand, kidney cell membrane damage can result from antibiotics like polymyxin. Aminoglycosides can also build up in kidney cells, harming renal tubules and resulting in cell death. Although the precise mechanisms underlying antibiotic-induced kidney injury remain poorly understood, they frequently entail renal cell damage and inflammation. It's crucial to use antibiotics carefully to make sure they work and are healthy for your kidneys. Did you know that about 1/3 of U.S. prescriptions for antibiotics don't match the diseases they are meant to treat? The Centers for Disease Control and Prevention, CDC, and a research that was published in the American Medical Association Journal provided this information. Know which problems antibiotics can cure before asking for them or if your doctor prescribes them. Consult your physician if this is required. The majority of doctors will readily explain the necessity. If antibiotics are really necessary, strictly follow the dosage recommendations and adhere by any dietary restrictions. Even after you feel better, never give or save your prescribed antibiotics for later use because each prescription is specific to your health and situation. Do you like our video? If you could please like this, we'll make more videos similar to this one. Non-steroidal anti-inflammatory medications are number 6. Though many individuals may not be familiar with the term NSAIDs, you've probably heard of ibuprofen, aspirin, Motrin, celecoxib, and naproxen. All of these are NSAIDs and some of them are available over the counter. Actually, About 30 million people take NSAIDs on a daily basis. They are frequently used to treat arthritis, pain, colds, sprains, headaches, and flu. NSAIDs function by inhibiting cyclooxygenase, COX, an enzyme involved in the synthesis of analgesics. COX, however, also helps control the excretion of water and salt and safeguards the kidneys during times of stress. Because NSAIDs block COX, they can damage your kidneys. Acute kidney injury, AKI, can result from any NSAIDs, particularly in elderly patients and those who take them often or in high dosages. Two primary mechanisms of harm are altered blood flow and inflammation, both of which are brought on by COX blockage. First, kidney blood channels can narrow due to COX blockage, which lowers blood flow. High blood pressure, fluid retention, and temporary renal impairment may result from this. If left untreated, it could result in serious problems such as acute tubular necrosis, which can induce acute renal failure by killing kidney tubules from a shortage of oxygen. Chronic kidney disease can develop from acute kidney failure. Second, even while NSAIDs reduce inflammation, long-term usage can cause inflammation in the renal tubules, which are responsible for waste filtration. While NSAID-related kidney problems are a serious concern, affecting 1% to 5% of daily users globally, inflammation of this kind is uncommon. This indicates that between 500,000 and 2.5 million people suffer renal damage as a result of NSAIDs annually. To make matters worse, NSAIDs are frequently linked to hospitalizations as a result of adverse medication events, some of which are fatal. The Journal of the American Society of Nephrology published a 2006 study that examined data from more than 10,984 NSAID prescriptions. The results of the study demonstrated the need for caution when using NSAIDs, as they increased the risk of acute renal injury by 26%, particularly in the first 30 days of treatment. Scientists examined 99 patients with long-term musculoskeletal pain who used NSAIDs for a full year in a different trial. They discovered that the majority of patients' renal function deteriorated while they used NSAIDs but returned to normal when they used a different type of painkiller. Now, you might be surprised to learn that the following group of medications on our list are generally thought to be beneficial for kidney health. Number 5. Diuretics that can affect your kidneys. Diuretics are used to treat disorders such as edema or fluid retention, which are frequently observed in liver cirrhosis, heart failure, and kidney failure. While some diuretics can be bought over the counter, prescription diuretics are usually more potent. Among the most widely used ones are acetazolamide, Diamox, Bumex, furosemide, Lasix, spironolactone, aldactone, and hydrochlorothiazide, HCTZ. They function by boosting the amount of urine produced and eliminating extra salt and water, which can help reduce hypertension, a significant risk factor for kidney disease. Diuretics are therefore generally good for your kidneys. Diuretics do have certain hazards, particularly for the health of the kidneys, even though they are generally beneficial. Unlike NSAIDs, they do not directly harm the kidneys. Instead, they alter the concentration and composition of urine by raising its volume and altering its electrolyte levels. Dehydration is a risk factor for kidney injury and can be brought on by using diuretics excessively or in large doses. A research conducted at a hospital between 1999 and 2010 looked at 1,331 diuretic-using individuals who suffered acute renal damage. Prior to beginning diuretics, 96.2% of these patients had at least one medical condition, with chronic kidney disease, CKD, accounting for the majority at 55%. According to the study, renal disease and associated risk factors, such as diabetes and hypertension, were more common in diuretic users. Increasing the dosage also increases the danger. Diuretics alone were responsible for roughly 27.5% of instances of acute renal damage. Other cases were brought on by a combination of diuretics and other medications. Prior to beginning any new drug, including diuretics, always check with your doctor. It's crucial to stay hydrated and to routinely evaluate kidney function and electrolytes for persons with chronic kidney disease, CKD, who use diuretics. You can monitor your kidney function from home these days because to the increased availability of home testing alternatives. Number 4. Proton pump inhibitors, PPIs, that can affect your kidneys. Proton pump inhibitors, PPIs, are often prescribed over-the-counter drugs. By lowering the production of stomach acid, they successfully cure diseases like acid reflux or gastroesophageal reflux disease, GERD. PPIs work against the stomach enzyme known as hydrogen ATPase, also known as the proton pump, which is essential for the secretion of acid. PPIs pose a risk, particularly to the health of the kidneys, even though they are usually safe and effective at treating acid reflux disease and other acid reflux symptoms. Acute interstitial nephritis, AIN, a kidney disease characterized by inflammation in the gaps between the renal tubules, has been related to PPIs. PPIs are becoming a common source of drug-induced AIN in industrialized nations, even though only a tiny percentage of PPI users get AIN. PPI-related AIN frequently has no obvious symptoms and can go undiagnosed. Chronic kidney disease, CKD, can develop from sudden acute renal injury and decreased kidney function brought on by long-term PPI use. Hypomagnesemia, or low blood magnesium levels, is another negative effect of long-term PPI usage and is associated with chronic kidney disease. Kidney illness can result from hypomagnesemia, which can also cause inflammation and upset your electrolyte balance. In addition, it may result in seizures, abnormal heartbeats, and spasms of the muscles. The effects of PPIs on kidney function were investigated in a 2019 study published in the Journal of Pharmacotherapy. The study looked at the relationship between PPI use and new cases of acute kidney injury, AKI, and chronic kidney disease, CKD, in a large number of people. They discovered that among 93,635 individuals, PPI users had an AKI risk that was 4.35 times higher than that of non-users. In a similar vein, 84,600 PPI users were 1.2 times more likely to develop chronic kidney disease, CKD, than non-users. As a result, patients using PPIs should have routine examinations to check their magnesium and renal function. Although PPIs can significantly reduce acid reflux symptoms, prolonged use of PPIs might damage your kidneys and lead to severe complications such as infections, fractures, or nutritional shortages. In order to treat acid-related problems without raising the danger of adverse effects, it's critical to use PPIs for as little time as possible. Number 3. ACE inhibitors that can affect your kidneys. Prescription drugs known as angiotensin-converting enzyme, ACE inhibitors, are frequently used to control kidney, heart, and blood vessel problems as well as lower blood pressure. Benazepril, Lotensin, enalapril, Vasotec, and lisinopril, Zestril, are examples of common ACE inhibitors. These medications function by preventing the production of the hormone angiotensin II, which constricts blood vessels and raises blood pressure. ACE medications help relax blood arteries, decreasing blood pressure, and lessening cardiac strain by inhibiting this enzyme. Additionally, by increasing blood flow to the kidneys, ACE inhibitors lessen the strain on them and offer long-term protection. They are a suggested treatment for individuals with renal illness because they can lessen the amount of protein in the urine, a typical problem in chronic kidney disorders. ACE inhibitors have advantages in terms of protection, but they also pose hazards. Their combination with diuretics and NSAIDs may raise the risk of acute kidney damage, AKI. Moreover, using ACE inhibitors and not getting enough water can increase your risk of AKI. It's essential to discuss strategies to reduce your risk of AKI with your doctor if you're concerned about it while taking these medications. Concerns have been raised by some that ACE inhibitors may lower estimated glomerular filtration rate, eGFR, a measure of renal function. ACE inhibitors, on the other hand, decrease eGFR by lowering kidney pressure and allowing the glomeruli, which are tiny filters, to relax. Although eGFR may slightly fall as a result, renal problems is not indicated. It indicates a relaxation of the kidneys. On the other hand, Patients with heart failure, chronic kidney disease, or blockage in both renal arteries may experience an excessive decrease in eGFR on occasionally. In order to determine the cause, your doctor might change your dosage or temporarily stop the medication if this occurs. Rarely, ACE inhibitors can result in acute renal failure, especially in individuals with heart failure or severe dehydration. Even in cases when dialysis is initially required, most individuals manage to stop the medicine and recover without any long-term renal damage. ACE inhibitors help individuals with diabetes, chronic renal disease, and heart failure because they lessen kidney strain and provide long-term protection. On the other hand, renal function should be routinely assessed and dosages should be carefully adjusted. Number 2. Antiviral drugs that may harm your kidneys. Antiviral medications are prescribed by doctors for serious or chronic illnesses such as COVID-19, Ebola, flu, genital herpes, hepatitis B and C, and HIV. However, most viruses resolve on their own without them. These medications can combat other viruses and help get rid of the flu. Tamiflu and Reliance are two typical antiviral medications for the flu. Antivirals for chronic infections such as HIV, hepatitis, and herpes can lessen the intensity and improve symptoms, but they cannot entirely cure the infection. Antiviral medications are helpful, but they can damage the kidneys. Kidney stones can be caused by direct toxicity or crystal accumulation, which carries this danger. Customized therapy and cautious management are crucial, particularly for individuals who already have kidney issues. Consider the medicine remdesivir, which is used in COVID-19 instances. Remdesivir contains SBECD, which is mostly eliminated via the kidneys. Renal toxicity may result from SBECD accumulation in individuals with kidney problems. Remdesivir-induced reduced kidney function has been sporadically documented in certain clinical trials. Comparing remdesivir to other COVID-19 medications, data from global database bases revealed an alarming increase in cases of severe kidney failure. Nevertheless, additional extensive research is required to validate its safety for individuals with kidney problems. Acute tubular necrosis, ATN, is the result of various antiviral medications such as tenofovir, acyclovir, and foscarnet that directly kill kidney tubule cells by decreasing blood flow or raising toxins. Crystal accumulation in the kidneys caused by acyclovir and foscarnet can obstruct tubules. In addition to managing viral infections, certain medications, such as foscarnet, include a risk of renal failure. Take antiviral medications under strict physician care to ensure safe usage. Never miss a dosage or take them irregularly because doing so can cause antiviral resistance, which will reduce the effectiveness of the medications. Recall that antiviral medications can only be purchased with a prescription. Do not purchase them from unofficial or internet sellers. First on the list, lithium. Lithium is a prescription drug used to treat mental diseases including bipolar disorder and mania that result in severe mood fluctuations. It also stabilizes mood. Lithium is sometimes marketed under the names Priadel, Camcolit, and Liquid. Lithium has been helping many people manage bipolar disorder for more than 60 years. Lithium can harm the kidneys even though it is necessary for mood regulation. Serious kidney issues, such as acute and chronic kidney disease and kidney cysts, might result with long-term use. Lithium-induced kidney damage may be temporary at first, but it might eventually become irreversible. Nephrogenic diabetes insipidus, a kind of diabetes unrelated to hyperglycemia but associated with kidney impairment, is a serious problem associated with lithium use. The illness causes excessive thirst and frequent urination because the kidneys are unable to respond appropriately to a hormone that regulates fluid balance. Rarely, chronic lithium usage might result in end-stage renal disease, ESRD. Excessive urine production, persistent thirst, frequent urination at night, and indicators of dehydration such as low blood pressure and a rapid heartbeat are all symptoms of renal problems caused by lithium. In extreme circumstances, mental health may also be impacted. Furthermore, lithium can result in hyponatremia, a condition when the kidneys discharge too much sodium. Sudden drops in sodium levels can result in fatalities, as well as major issues such as acute disorientation, seizures, coma, and muscular breakdown. When using lithium, patients should keep a normal diet that includes adequate amounts of salt and water. It's critical to determine an appropriate dosage, obtain yearly blood tests to monitor creatinine levels, and receive medical attention if something appears off. Notify your doctor about any kidney, heart, thyroid, or breathing issues, Addison's illness, or Brugada syndrome before beginning lithium treatment. Additional advice on safe usage. Consult a doctor straight immediately if you believe that your medicine is having an adverse effect on the health of your kidneys. Kidney failure may not show any symptoms in the beginning, but as it becomes worse, you might notice decreased urine production, leg edema, shortness of breath, and severe fatigue. These may become fatal if left unchecked. Make a note of these signs so you can react appropriately. Regularly monitor your kidney function with blood tests for creatinine levels, glomerular filtration rate, GFR, and protein levels in your urine if you use any of the medications listed above. Being well hydrated lessens the negative effects of medications by aiding your kidneys in eliminating urea, salt, and other waste products. Be mindful of any drug interactions that might have an impact on your kidneys. Any medical professional who prescribes a new medication should know about all of your current prescriptions. While many ailments require the use of pharmaceuticals, some of them carry serious dangers to kidney function and should only be taken under strict supervision. Antibiotics, NSAIDs, diuretics, proton pump inhibitors, ACE inhibitors, antiviral medications, and lithium can all affect kidney function through a variety of mechanisms, including direct toxicity, blood flow disruption, and electrolyte imbalances. This is especially true for people who already have kidney disease or are at risk for it. It is imperative that people with renal illness avoid or take these drugs very cautiously. Consult closely with medical professionals to select therapies that reduce renal risk, modify dosages as needed, and routinely assess kidney function. Living a healthy lifestyle can reduce the need for medication. To preserve your kidneys, maintain a healthy diet that includes fruits, vegetables, lean protein, and frequent exercise. Subscribe and click the bell symbol to receive alerts for further information on kidney health. Bye.